Welcome back guys. Now in this video let's discuss about antidiuretic hormone and its function. In the name itself it's very clear. See, antidiuretic hormone means anti to diuresis, or we can say anti-urination, or we can say antidiuretic hormone decreases the amount of urine. Okay, so if for example imagine let's inject antidiuretic hormone into a person. If we inject antidiuretic hormone into a person, what will happen? It will decrease the amount of urine production in this person. Okay, that's how antidiuretic hormone is going to work. Now, from where this antidiuretic hormone is produced? Antidiuretic hormone is produced from the posterior pituitary? No, it is produced from hypothalamus. Okay, so antidiuretic hormone is produced from the hypothalamus. Now, in hypothalamus, which nucleus is producing this antidiuretic hormone? The nucleus which producing the antidiuretic hormone is called as supraoptic nucleus. Okay, SON stands for supraoptic nucleus from the hypothalamus is going to produce our antidiuretic hormone. Now, this antidiuretic hormone is stored in one place. Where it is getting stored? It is stored in the posterior pituitary. Okay. Now, in the posterior pituitary gland, the antidiuretic hormone is stored. Guys, don't confuse. Most of the students will think antidiuretic hormone is getting produced from the posterior pituitary. No, antidiuretic hormone is stored in the posterior pituitary but produced in the hypothalamus by supraoptic nucleus. Now, this antidiuretic hormone, it acts on which part? Definitely it acts on the kidney, definitely it acts on the nephrons. Which part of the nephron? PCT, descending limb of loop of Henle, hairpin turn, ascending limb of loop of Henle, or distal convoluted tubules or collecting ducts. Mainly the antidiuretic hormone is going to act on the collecting ducts. Now, we have seen on collecting ducts there are two main different types of cells, principal cells and intercalated cells. Now, please try to recollect. Aldosterone is acting on which cells? Aldosterone acts on both principal cells as well as intercalated cells. Helps in reabsorption of sodium, excretion of potassium, that we have already seen. Now, we are discussing about the antidiuretic hormone, not aldosterone. Antidiuretic hormone, it acts on collecting ducts, but it acts on which cells? Principal cells, not the intercalated cells. Okay, principal cells. So, our ADH hormone, it's acting on the collecting ducts, mainly on the principal cells. Now, on the principal cells, what is the receptor for the antidiuretic hormone? Please try to recollect. Aldosterone is having intracellular receptor. Aldosterone is a steroid, it crosses the cell membrane, it enters into the cell, and the receptor for aldosterone is present inside the cytoplasm. But antidiuretic hormone is not like that. Antidiuretic hormone is not a steroid, so it cannot cross the cell membrane. So, antidiuretic hormone is acting on principal cell, but where the receptor is present? Receptor is present on the cell surface. And what is the name of that receptor? The name of the receptor is V2 receptor. Okay, so antidiuretic hormone, it is acting on which receptor? V2 receptor. So, where V2 receptor is present? V2 receptor is present on the collecting ducts. So, what is the function of antidiuretic hormone? Antidiuretic hormone reabsorbs the water. Remember guys, normally collecting ducts, are they reabsorbing any water? No. Normally collecting ducts are not reabsorbing any water in a normal condition. But whenever there is ADH, or I should say only under the influence of antidiuretic hormone, collecting ducts will reabsorb the water. So, water reabsorption in collecting ducts is dependent on hormone. So, it is facultative water reabsorption. Please try to recollect, in PCT, there is no facultative water reabsorption. The reabsorption in PCT is just because of the solutes. Sodium is reabsorbed, water is reabsorbed. There are no hormones acting on the PCT for the reabsorption of water. But collecting duct is only permeable to water. Collecting duct is only reabsorbing water under the influence of antidiuretic hormone. How it will happen, we will see in a minute. Okay, now let's continue guys. See in this image, what we are showing you, this topmost portion, this part, okay, let me highlight it so that it will be clear for you. See, what is this part? This is the hypothalamus. I have already taught you in hypothalamus there are different nuclei. Now this is the first nucleus. What is this violet color nucleus? See, this violet color nucleus which I am showing you is a supraoptic nucleus. Now what is the function of this violet color nucleus, supraoptic nucleus? I have already taught you. It is going to produce antidiuretic hormone. Now this antidiuretic hormone, where it will come? It will come and getting stored in the posterior pituitary. In the same way, remember there is one more hormone which is produced from the hypothalamus and which is getting stored in the posterior pituitary. What is that hormone? That is oxytocin. Okay, even oxytocin is getting produced from the hypothalamus. From which nucleus? See, this is the yellow color nucleus which is producing the oxytocin. What is the name of this yellow color nucleus? Paraventricular nucleus. So the paraventricular nucleus from the hypothalamus is going to produce the oxytocin, and oxytocin is coming and getting stored in the posterior pituitary. So what are the hormones which are stored in the posterior pituitary? Two hormones. One is oxytocin and second one is antidiuretic hormone. See, can you name me what is the other name of antidiuretic hormone? Antidiuretic hormone ADH is also called as vasopressin. So, if I use antidiuretic hormone or if I use the name vasopressin, it's one and the same. Okay. Now, how to remember which nucleus is producing which hormone? See, the mnemonic is SOAP, S-O-A-P. I used to remember something like this. See, S for supraoptic nucleus. Supraoptic nucleus, it's going to produce antidiuretic hormone. And paraventricular nucleus is producing oxytocin. Never ever confuse supraoptic nucleus produces oxytocin. Don't. See, supraoptic nucleus, take the arrow and attach it to A. Okay, supraoptic nucleus produces antidiuretic hormone, paraventricular nucleus produces oxytocin. So this is how you can remember the hormones which are getting produced from the hypothalamus and getting stored in the posterior pituitary. Now let's see how antidiuretic hormone or vasopressin is going to act on the collecting ducts and how reabsorption of water is going to happen. Guys, see, this is the lumen of the collecting duct. This is the lumen. This is the place where your urine is flowing and this is the place where water is there. Normally, I have already taught you collecting ducts are impermeable to water. Collecting ducts are not reabsorbing any water. But in our condition, let's take antidiuretic hormone. Okay, now we are putting the antidiuretic hormone. Now, whenever there is antidiuretic hormone, what happens? I have already taught you antidiuretic hormone is going to act on which cell? Principal cell. On the surface of principal cell, which receptor is there? V2 receptors are there. So, our antidiuretic hormone which is coming from the posterior pituitary, it is coming and acting on the V2 receptors. Whenever the V2 receptors are activated, what happens? Intracellular G proteins are going to be activated. Now, intracellular CAMP levels will be increased, and whenever intracellular CAMP levels are increased, a cascade of events are going to take place. But at the end of the day, what is important? Whenever antidiuretic hormone is acting on the V2 receptors, there is implantation of these water channels. Are you able to appreciate these blue color water channels? These blue color water channels are not there before. Only these blue color water channels or water transporters are implanted here only under the influence of antidiuretic hormone. So, whenever there is antidiuretic hormone, then these water channels are placed here. What is the name of these water channels? These are called as aquaporin 2 channels. Okay, we have discussed about the aquaporin 1 channels. Where we have discussed them? We have discussed them in the topic of descending limb of loop of Henle. In descending limb of loop of Henle, water reabsorption happens from which water channels? Aquaporin 1. Now this is aquaporin 2. Where aquaporin 2 channels are there? Aquaporin 2 channels are present in principal cells, in collecting ducts. When? Only under the influence of antidiuretic hormone. So water reabsorption is happening. Okay, this is how water reabsorption happens. Never ever say antidiuretic hormone is helping in the reabsorption of sodium. No, there is no sodium reabsorption, just simple water reabsorption. How this is special? Guys, previously what we have discussed? We have discussed wherever sodium goes, water will follow. Normally, water reabsorption is sodium dependent or solute dependent. Wherever solutes move, water is going to follow there. But here exception is the water reabsorption, whatever is happening in this condition. Now this water reabsorption is solute free water reabsorption. Without any solute, water is getting reabsorbed. So this is called as solute free water reabsorption as well as facultative water reabsorption. What does I mean by facultative water reabsorption? The water reabsorption is dependent on a hormone. Which hormone? Antidiuretic hormone. So it is facultative water reabsorption. Facultative water reabsorption is because of antidiuretic hormone. Completed. In which part of nephron facultative water reabsorption happens? In collecting ducts in principal cells with the help of aquaporin 2 channels. And water reabsorption in collecting duct, is it solute free water reabsorption or solute dependent water reabsorption? It is solute free water reabsorption. Okay, there is no sodium reabsorption, only pure water is getting reabsorbed. Having said that, let's discuss about one more important point which have been asked in the exam. What is that? Normally, what we have seen, antidiuretic hormone, it's acting on the collecting ducts, helps in water reabsorption. But also remember guys, this antidiuretic hormone not only acts on the collecting ducts, yes, it acts on the collecting ducts, it acts on the principal cells, helps in water reabsorption, no doubt. But the antidiuretic hormone also acts on the PCT and helps in more water reabsorption. That's the function of antidiuretic hormone, right? Antidiuretic hormone wants to reabsorb as much as water as possible. Okay, but the question is, antidiuretic hormone acts where? Yes, it acts on collecting ducts, it acts on principal cells, no doubt. But the major action of the antidiuretic hormone is seen on the PCT. So, under the action of antidiuretic hormone, the greatest volume of water is reabsorbed in. Most of the water reabsorption happens in PCT. But why we have discussed about the collecting ducts? What is so much important about the collecting ducts? Normally collecting ducts are impermeable to water, but whenever there is antidiuretic hormone, now in these conditions, even the collecting ducts also become permeable to water. But most of the water reabsorption happen where? Most of the water reabsorption happens in the PCT. Okay. Now, guys, we have seen antidiuretic hormone acting on the V2 receptors on the principal cells. Yes, we know. But antidiuretic hormone is also called as vasopressin. In the name itself it is there, it is vasopressin, means it presses the blood vessels, it constricts the blood vessels. So what is the receptor present on the blood vessel? It's not V2 receptor, it is something different receptor. What is that? It is a V1 receptor. So there are other receptors for the antidiuretic hormone, not only V2. Yes, we have seen V2 receptors are presenting on the collecting ducts, helps in water reabsorption. But what I am saying, antidiuretic hormone is having V1 receptor, where V1 receptor is present on the blood vessels, smooth muscles of the blood vessels. Now whenever that V1 receptor is stimulated, what happens? Vessels will undergo vasoconstriction. Okay, if you have a vasodilation in any condition, if you want to constrict them, you just stimulate the V1 receptors. Stimulation of V1 receptors by antidiuretic hormone will cause vasoconstriction. Or you just make a drug, you just synthesize a drug from a factory, and that drug, what it is doing, if it stimulates V1 receptor, what happens? Immediately the blood vessels will undergo constriction. So V1 receptor stimulation will cause vasoconstriction. V2 receptors, where they are present in the collecting ducts, helps in the water reabsorption with the help of aquaporins 2 channels. Now remember, the V2 receptors are also present on the vascular endothelial cells. Now whenever the V2 receptors which are present on the vascular endothelial cells are stimulated, now these vascular endothelial cells will release von Willebrand's factor. Now what is von Willebrand's factor? Von Willebrand factor is something which helps in platelet adhesion and platelet aggregation and that clot formation. So think like this, there was this one patient who is having bleeding problems, he is having bleeding disorders. Okay, he is simply bleeding. Now how to treat his bleeding disorders? We know from the concept of antidiuretic hormone, the antidiuretic hormone receptors, V2 receptors, are present on the vascular endothelium. If you can stimulate the V2 receptors on vascular endothelium, it releases more and more von Willebrand factor. That von Willebrand factor helps in primary clot formation. It helps in platelet adhesion, platelet aggregation. So bleeding will be stopped. So if you stimulate the V2 receptors, that can help in treatment of hemophilia. Hemophilia means bleeding disorders. So hemophilias are treated by stimulating which receptor? V2 receptor. which is present on vascular endothelium. Stimulation of V2 receptor on vascular endothelium will release which factor? Von Willebrand factor. Helps in treatment of hemophilias. MCQ. Okay. V3 receptor, where it is present. This V3 receptor is also the receptor of antidiuretic hormone, which is present in the anterior pituitary. Okay. So, antidiuretic hormone from the posterior pituitary, see, from the posterior pituitary is going to come into the anterior pituitary. It is going to act on the V3 receptors, and what it will do? It helps in production of ACTH. We all know ACTH helps in the production of cortisol. So, antidiuretic hormone by acting on the V3 receptors helps in production of ACTH. Where V3 receptors are present? V3 receptors are present in the anterior pituitary. Now, based on what we have learned so far, let's try to integrate with medicine. Okay, let's try to integrate with pharma also. For example, let's take a condition called as esophageal varices. Now, what are these esophageal varices? Please see in this image. I think you can still see in this image. See, this is the endoscopy of the esophagus. Endoscopy of the esophagus. Here, are you able to appreciate these dilated veins? All these dilated veins. Yes. So, what exactly are the esophageal varices? Esophageal varices are the dilation of the veins in the esophagus. Okay. Now, how to treat this condition? If the veins are dilated, as a good doctor, what you have to do? You have to make the veins to undergo constriction. You have to take the veins, go back to their normal patency. So, what you have to do? You have to constrict these blood vessels, constrict these veins. Now, how you can do that? I have taught you V1 receptors where they are present. V1 receptors are present on the smooth muscles of the blood vessels. If you stimulate the V1 receptors, which means a V1 agonistic drugs, V1 stimulation can cause vasoconstriction. That will treat the esophageal varices. So, V1 agonist, who is the V1 agonist? Terlipressin, the drug which we have manufactured. It's just like vasopressin. Okay, antidiuretic hormone is also called as vasopressin. That's something which produces in our body naturally. But if you make a similar analog, if you make a similar drug, that is called as terlipressin. So, terlipressin is a V1 agonist, is a drug of choice for esophageal varices. Now, V2 agonist. What is V2 agonist? The V2 agonist is called as the desmopressin. How this desmopressin is going to be helpful for us? We will discuss in a minute. See, this V2 agonist called as desmopressin is the drug of choice for diabetes insipidus. Now, what is this diabetes insipidus? How desmopressin is going to helpful for us? We will discuss in a few minutes. But before that, also please concentrate. I have shown you here the V2 agonist is also used in conditions like von Willebrand's disease. I am asking you, what is von Willebrand's disease? It's a hemophilia. In von Willebrand's disease, von Willebrand factor is deficient. Deficiency of von Willebrand factor. Now you think, von Willebrand factor, where it is present and who is going to release the von Willebrand factor? Von Willebrand factor is released by the vascular endothelium. Now, what is our problem? In a von Willebrand's disease condition, von Willebrand's factor is deficient. Now, as a good doctor, what you have to do? You have to increase the release. You have to increase the release of von Willebrand factor. How you can do that? We know on the vascular endothelium, V2 receptors are there. If you stimulate the V2 receptors, vascular endothelial cells will release more and more von Willebrand's factor, so that von Willebrand's disease is treated. Okay, so V2 agonist can be used in, V2 agonist like desmopressin can be used in treatment of von Willebrand's disease. It's a true statement. Now, after this, let's discuss about SIADH. Now, what is SIADH, sir, if you ask me? It's a syndrome of inappropriately antidiuretic hormone ADH is getting produced. Syndrome of inappropriate antidiuretic hormone synthesis. It's little complicated, right? So, try to understand it like this. So, syndrome of increased, I for increased, ADH, simple. The syndrome where antidiuretic hormone is increased. Very simple. More amount of antidiuretic hormone is there in the body. Now, why there is more amount of antidiuretic hormone? Because of a condition called as oat cell carcinoma or small cell carcinoma of lung. Now our patient is having a cancer to the lung. Which type of cancer? There are different types of cancers, like large cell cancer, small cell cancer, different types are there. Now our patient is having small cell carcinoma of lung, which is also called as oat cell carcinoma of lung. Now what this cancer is doing? Now this cancerous mass, abnormally it is producing antidiuretic hormone. Okay, cancers can produce anything, right? So you can see in the image, so much amount of antidiuretic hormone molecules are there. So many molecules are there. Now in this condition, just tell me, what happens? All these antidiuretic hormone molecules, they will come and act on the V2 receptors. Now V2 receptors are so much stimulated, so much antidiuretic hormone. Whenever there is so much amount of antidiuretic hormone, so much amount of water reabsorption will happen. Lots and lots of water is getting reabsorbed in the collecting duct. Then what happens to the concentration of urine? The person is going to produce concentrated urine or diluted urine. If so much amount of water is getting reabsorbed, the patient is going to produce super saturated urine, super concentrated urine. Or I can say the person is going to produce very little urine. The urine production is so much decreased. Why? Because so much amount of water is getting reabsorbed in the collecting ducts. Very simple. So much amount of antidiuretic hormone, so much water reabsorption. So less urine production. This is syndrome of inappropriate antidiuretic hormone synthesis, where the patient is going to produce hyperconcentrated urine or hyperosmolar urine because of too much amount of antidiuretic hormone. Now, as a good doctor, how you can treat this condition? First of all, if there is a cancer, we have to take out the cancer. Okay, we have to resect the cancer by surgically. Okay, but all the patients are not suitable for the surgeries. They might be having some contraindications. First, how we can treat it medically? How to treat the condition of SIADH by using drugs? See, let the antidiuretic hormone be there. Yes, too much amount of antidiuretic hormone is there. We can simply block the receptors. If you block the V2 receptors, can antidiuretic hormone act on the V2 receptors? No, it's not possible, right? So, how we are going to treat the SIADH? By the drug of choice? The drug of choice is V2 blockers. So, if you come and block this V2 receptors, antidiuretic hormone cannot act on the V2 receptors. Very simple. So, V2 blockers are the drug of choice of SIADH. What are those V2 blockers? Vaptan drugs. Which vaptans? Conivaptan, tolvaptan. Okay. So, conivaptan, tolvaptan, these are called as vaptan drugs. Vaptan drugs are drug of choice for SIADH. Okay, syndrome of inappropriate ADH synthesis by the lung cancer. SIADH completed. Guys, have you remembered that Vasopressin is the drug of choice for diabetes insipidus? Just before 2 slides, here we have discussed, right? Diabetes insipidus. I have asked you to just, okay, keep this point in your mind. We will discuss in a few minutes. Now let us discuss what is diabetes insipidus. Diabetes insipidus is a condition which is exactly opposite to SIADH. Now what is the problem in SIADH? Sir, the problem in SIADH is too much amount of ADH is there in the body. Too much amount of ADH is getting produced from the cancer. Now in diabetes insipidus, what is the problem? Please look at this image. Is there any ADH molecules are there? No, there are no ADH molecules, no ADH hormone is there, or I should say ADH is deficient. ADH is not getting properly produced. Whenever there is no ADH, what happens? V2 receptors are getting stimulated? No. So V2 receptors are not getting stimulated. If V2 receptors are not there means, can you expect here aquaporin 2 channels? Aquaporin 2 channels are there or not? No, the aquaporin 2 channels are not there. If aquaporin 2 channels are not there, water reabsorption happens in collecting ducts. Water reabsorption is not going to happen. So what happens? All the water is going to lost in the urine. So is he going to produce diluted urine or concentrated urine? Now the patient is going to produce diluted urine and so much volume of urine. Okay, all the water is getting lost in the urine. So the volume of urine getting produced is so much. Now how to treat this condition? It's very simple. As a good doctor, please answer this. If he is losing lots and lots of water, is that good? Definitely not. So as a good doctor, what you have to do? Okay, antidiuretic hormone is not there. Now what you have to do? You know. Okay, antidiuretic hormone, okay, just forget about the antidiuretic hormone. It's not there. Because of some reason, it's not there. Now, with the concept whatever we have studied, if you can stimulate this V2 receptor, automatically cells are going to implant the aquaporin 2 channels and water will start to be reabsorbed. Yes, so that's how we will treat the diabetes insipidus. How? By stimulating the V2 receptors, means V2 agonists. What is that V2 agonist? We already have seen. V2 agonist is nothing but desmopressin, which we will take intranasally, inhalation. Okay. So, whenever the person is suffering with the diabetes insipidus, in his body antidiuretic hormone is not there. Yes, okay. Now, what we have to do? We have to supply the antidiuretic hormone. Who is the analog of antidiuretic hormone? The analog of antidiuretic hormone is desmopressin. Just like vasopressin, we have made a drug called as a desmopressin. Now, what is desmopressin is doing? This desmopressin will go and act on the V2 receptors. When V2 receptors are activated, now water reabsorption is again coming back. Okay, so the diabetes insipidus is treated. Okay guys, we have discussed all the important points regarding the antidiuretic hormone, the production of antidiuretic hormone, the storing sites of antidiuretic hormone. We have seen the clinical integrations, 2 important syndromes, SIADH and diabetes insipidus, and how to treat those conditions. Hope the video is helpful. See you with the next topic.